Hello everybody, I am Dr. Puneet CS, consultant neurologist at Sri Gokulam Hospital, Salem. Today I will be talking on Parkinson's disease. So what is Parkinson's disease? Parkinson's disease is a disease of brain due to deficiency of chemical known as dopamine in the brain. So it causes various symptoms in the body, and most of the times it causes symptoms in one half of the body. This is usually seen in patients of age group of more than 50 years. Rarely it is also seen in younger age group. We call it as young onset Parkinson's disease. So most of the times the patient will be in the age group of more than 50 to 60 years. So the patient will have tremors of one side of the body. We call it as resting tremor. Patient will have slowness of one side of the body. Patient will also have stiffness of one side of the body, and when they are walking there will be decreased arm swing. So whenever you see a Parkinson's patient, they usually take more time for their day-to-day activity. For example, if they were taking 5 minutes for taking food, they will be taking more time, like for example 15 minutes or 30 minutes. Sometimes to day-to-day activities of daily living like bathing and all, they take longer time. So all the activities of daily living is slowed. So initially it will be mild. So we call it as mild Parkinson's disease. In those individuals, we start with the milder medications. So what are the causes for this Parkinson's disease? So what commonest cause for Parkinson's disease is known as idiopathic Parkinson's disease. As of now, we don't know what is the cause for this Parkinson's disease. There are various theories, but most of the times the imaging or any scan in the brain will be normal. Patient will be elderly. They will have symptoms starting from one half of the body in the form of tremors, slowness of activity of the body, stiffness, and while walking they will have decreased arm swing. They will take longer time to travel a particular distance. So this is a classical idiopathic Parkinson's disease. Then we have other causes, like patient will having multiple strokes, they can also have Parkinson's disease. Patients having neuroinfection can also have Parkinson's disease. Like neuroinfection is brain fever. So sometimes they land up with Parkinson's disease. Patients who is having past history of trauma, they can also have Parkinson's disease. The classical example is you might have heard of Muhammad Ali, who was a great boxer who had multiple punches while having during his boxing career. During his later half of the life, he developed post-traumatic Parkinsonism. So these are the causes, and sometimes tumor also can present with Parkinson's disease. So how do you diagnose this? One is symptoms. Whenever they come to our clinic with the symptom of tremors and slowness and stiffness, we diagnose clinically, and subsequently we evaluate with imaging. Any other causes are there which are treatable, for example a surgery or a tumor or past history of surgery or past history of trauma, those will be dealt separately, and then we treat symptomatic medications separately for tremors, stiffness and other things. Then when patient is having these medications, sometimes we need to escalate the medication or decrease the medication according to the response of the drugs. Then there is after 5 to 10 years of patient taking medication, the efficacy of the drugs progressively decreases beyond 10 years, 15 years and all. Now the latest treatment is in the form of a deep brain stimulation. It's like a pacemaker or electrode which is kept in the particular part of the brain, and like a pacemaker is kept in the subclavicular area. So these are the advances which are coming up with related to the Parkinson's disease. So any patient comes with tremors and then slowness and decrease in the speech, decrease swallowing abnormality, and any gait abnormality like recurrent falls, immediately take the patient to the neurologist so that proper treatment can be given in the form of medications as well as surgery, or in the form of a pacemaker implantation. So thank you.